A lot of people in Oregon think seniors should be vaccinated before teachers, considering, they're the ones who are dying by an overwhelming percentage. So the state said, I got an idea. Let's just release less data and announced a plan to stop telling us detailed information about who dies from COVID.
So it just appears that they're covering up because we are one of the few states who is not vaccinating people over 65 right now.
And Washington says, don't even try it. We know what you're up to, Oregon, and they'll have bouncers at the door ready to check IDs if you're thinking of driving north for a vaccine. And we're making a list, checking it twice, of every Oregon State Republican lawmaker who responds to their party's lies about the insurrection at the U.S. Capitol. Here's the story.
All right. Hey, lots to talk about. We got to get right into it tonight. I'm Dan Haggerty. This is the story. You know the drill. All the ways to reach out to us at the bottom of your screen. Don't forget to use the hashtag HeyDan. It's big story time. Now, the Oregon Health Authority, we were talking about it off the top. They're changing the way it reports deaths. For 11 months now, the state has given us detailed information about each person who died. Now, essentially out of nowhere, the state says it's changing what we get to know. And even before we reported this development, we started hearing from some of you at home, like Bill, who said, hey, Dan, I hope this is not a veiled attempt by OHA to cover up the number of seniors that die, while the governor prioritizes educators and others ahead of seniors who have experienced the greatest death rate for the COVID vaccine. Given that OHA has been producing this data for months, why wouldn't they finish this project so that there is consistent data set across the entire pandemic timeframe? And it is a good question. And our Kristen Severance set out to answer it.
We heard from story viewers like Dennis Gavin and Sarah Thomas as soon as the state announced a change in the way deaths would be reported.
To me, there's a perception of that they're hiding information now. They don't want to report the people over 65 because they have decided to favor the school teachers, even though schools have no plans to open in the near future.
Since March, the Oregon Health Authority provided a person's age, county, location of death, date when they tested positive for COVID, and the date when they died, and if they had underlying conditions. The state did this in the spirit of transparency after Governor Brown told the agency to release all COVID-related information with the public that doesn't compromise patient privacy. Now the agency will show all the deaths on these charts. An age range will be listed, but not the person's gender, where they lived, when they tested positive, when they died, and if they had underlying conditions.
The information is easy to come by, easy to put on site. You do it every night. You quote statistics all the time. It's not like it's hard for them to put it on. They've been doing it for months.
The Oregon Health Authority told me verifying each death certificate was too much work for their epidemiologist. The change had been in the works for a while, and the dashboard will still give an accurate look at the data. Shireen Tagarobi is an attorney with the First Amendment Coalition, a nonprofit pushing for a more accountable government. She said states should be releasing more data, not less.
Especially right now during this pandemic, the government is wielding extraordinary power, right? The power to close people's businesses, the power to affect their livelihoods, and ultimately their lives. And so the government and local authorities owe it to the people to disclose as much data as possible about what's driving those decisions that are ultimately so affecting people's lives.
And especially when Brown is under intense criticism for putting teachers ahead of seniors in the vaccination line. The way the deaths will now be reported, we won't be able to see exactly how many seniors tested positive and died while waiting for a vaccine.
I think, like him, I'm suspicious that they're not doing it because people got mad that the teachers bumped up over older people.
It's disingenuous to say that it's too much work when you're only reporting maybe a dozen people at a time when they come in. It's not like they're reporting hundreds or thousands like in other states. So it just appears that they're covering up because we are one of the few states who is not vaccinating people over 65 right now.
A spokesman for Governor Brown told me this was an internal OHA decision. But he said OHA will still be able to release information about COVID deaths, including an age range. That is true, but not specific details like how old the person was, where they lived, when they tested positive, and when they died. Dan?
Kristen, thank you. And before we move on here, I do have something really quick to say about this. See, the head of OHA, Patrick Allen, said in a statement that, quote, every death from COVID-19 represents a loss, especially for those who knew them best, families, friends, and loved ones. And that is why we have listed each case. And I kind of was surprised by that. I didn't realize that. I thought it was so that people knew what you knew, the OHA. Because those families are not the only ones interested in that information that you, the OHA, hold the keys to. And I'm not sure if you've noticed, but people are paying a lot of attention nowadays to the ones holding the keys, right? From BLM and the relationship with police, to business owners shut down by the governor, to how COVID deaths are classified and counted. People have made it very clear that they want transparency. And we have seen time and time again, when the people in power leave us out of the conversation, misinformation will fill that void, and that spreads faster than any virus. Now, I'll admit, I'm biased here. I'm a journalist. I don't like being left in the dark, so I recommend you keep the lights on. But that's just me. Let's turn now to the next vaccine topic of outrage, shall we? I'm getting a lot of comments like this one from Joshua. He says, hey, Dan, Beaverton School District just announced they won't be having students back until maybe early mid-April at the earliest for younger kids, with no option for middle or high school students. So why are BSD staff and teachers getting vaccines ahead of the elderly again? So yeah, if you missed it last night, Beaverton announced plans for limited in-person learning starting February 22nd, but only for students with disabilities, English language learners, and kids without internet access. Then in April, elementary students will start hybrid learning, so that's kind of a mix of in-person and online. And like Joshua pointed out, middle and high school students are staying online. So a lot of people are saying, wait a minute. I thought the entire reason for vaccinating teachers first was so that we could reopen schools. But if one of the largest districts in the state isn't really reopening for months, what's the point? And it's a good question, and it's one we don't have an answer to. But we're going to try and get that answer tomorrow. See, we finally are getting some one-on-one time with Governor Kate Brown, and that's the first question we're going to ask her. But we're going to have some more questions to ask her, and we're hoping those come from you. I asked you today on my Facebook page to give us some questions. I already have about 100 responses. So we want to kind of be this bridge between you and the governor. So please let us know what you want to get answered, and we'll try to see what she has to say about it tomorrow night on The Story. Now we want to take a quick look kind of overall at the vaccine count here in this state as of this afternoon. Almost 300,000 people, right? So we're getting there. And these are people who have gotten at least the first dose. Some of these people have gotten the second one, but that number represents people who have gotten at least one shot. That works out to be a little bit more than 7% of the state's population. Now we've been tracking this, and the vaccinations, there it is, have been steadily going up 0.3% every single day this week. So we are seeing a little bit of progress, and we've been doing some math too and found that if Oregon continues vaccinating at this rate, we'll hit herd immunity, that's 75%, by September. Of course, we're all hoping it happens a lot sooner than that, but we're going to continue to keep our eyes on this. We're also keeping an eye on Washington, despite this email we got from Lauren. It says, you constantly do Oregon, 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 but ignore us in Southwest Washington. I'm going to give up on watching your show because of frustration. Lauren, please don't go anywhere. I'm sorry. We need to do better. I can admit that. In the meantime, let's go to our resident Washingtonian, Tim Gordon, to talk to us about the vaccine rollout up there. I've been hearing about these mass vaccination sites. One just opened in Clark County. How's that going, Tim?
Good. First of all, Lauren, I'm trying, man. I'm just as many stories up here as I can. So, Dan, to answer your question, this is day 3 of 4. Well, day 3 is over now. And, you know, as far as I could know, I was there the opening day on Tuesday. I was there again today, covered Governor Jay Inslee being there, along with the Secretary of Health for Washington State. And the 2 days that I've been up there, it seems to be running quite smoothly. It's a pretty cool setup. It's a drive-through setup. This kind of exhibit barn, 2 open ends, but a roof over the top, so people stay in their cars, but it's covered. And, you know, they're trying to do 750 a day to get through 3,000 doses this week. Tomorrow's day 4, and they'll be done for the week. And so I think it's going pretty well. The big challenge is knowing how many doses are available next week so that they can actually schedule people and make appointments. All those people waiting and trying to get through and get an appointment are still waiting to find out what the allotment will be, and so they can get.
We've done stories about people from Oregon driving up to Washington where they're kind of there's different protocol about who is getting shots when. And Washington's coming out and saying now they're warning Oregonians, do not cross the border and come up here and try and get a shot. Do you know how they're going to even try to enforce that at all?
Right. I mean, it did get kind of tricky because in Washington, Inslee went to say, people 65 and older, people 50 years and older in multi-generational households could go ahead and get vaccinated. And that wasn't the case in Oregon. So, a lot of people want to come up here and do that. And Washington, frankly, didn't have a system. At first, they were saying, we're not checking residency in order to get a vaccine. So it kind of made it kind of an open season. I haven't gotten any data in terms of how many Oregonians were actually trying to come up here. But anecdotally, we hear what's happening. But anyway, yesterday, Washington State put out a thing saying, you know what, now we really don't want you to come up. We can't do that. We may well ask people for their residency status proof of, or that they have proof of employment up here in order to get vaccinated in Washington. Today, Governor Jay Inslee at this drive-through clinic that we saw him at said, yeah, that's the case. We think Oregonians understand. We've only got enough for ourselves up here, and you stay in Oregon.
Yeah. Makes sense. Tim Gordon, thank you so much. Keep us informed on all the things happening in Southwest Washington.
Scientist, because, why not? When the story continues.
Welcome back. Hey, this is The Story. Keep sending me those questions you want us to ask Governor Kate Brown. We're interviewing her again, a one-on-one tomorrow. You can send those to me on Facebook. Just search Dan Haggerty KGW or use any of the other ways you use to kind of communicate with us. I'd like to address the elephant in the room, but it won't return my calls. The Oregon GOP has, let's say, some splaining to do after writing, voting on, and publishing this resolution that says the Capitol riot was a false flag operation meant to discredit President Trump and make Republicans look bad. And just to make sure we're all kind of on the same page here, Claudia sent me this email after our coverage last night, and she said, I didn't know exactly what the term false flag meant, so I looked it up. Basically, to summarize this perspective here, calling the assault a false flag operation means that you believe people were pretending to be Trump supporters by the hundreds or even thousands to then storm the Capitol, risking their life, imprisonment, and shame just to make President Trump look bad. And that all of it was coordinated in a way that made it impossible for the FBI to find any credible evidence. And forgive me, but this doesn't exactly look like Ocean's 11. But if you need more than a bad joke to let the point kind of sink in, the FBI has dispelled this theory thoroughly and instead has built its own based on hundreds of open cases and nearly 140 arrests. The only evidence that is growing shows the assault was planned and perpetrated by Trump supporters, right-wing militants, white supremacists, Q people, and the like. Now, for a couple of days now, I've been trying to get in touch with Bill Currier. He is the chairman of the GOP executive committee that drafted the false flag resolution, but I haven't heard back yet. But I did get this email from a viewer named Bob today that said, hey, the GOP leader Currier was interviewed on KSLM radio in Salem this morning. So I hopped online. I pulled up the interview. I got to listening. It's a conservative opinion show called Good Morning Salem with Stacey Ann. And during this 45-minute interview, the false flag resolution never came up, if you can believe it. Instead, they talked about the need for the party to stick together. And I think you can guess the glue that would bind them.
President Trump has made it very clear to us here in the Oregon delegation. We had a chance to meet with a number of his top people while we were in Florida, and also since then we've been in communication. He's made it very clear in advance of all the rumors that were swirling around in the last few weeks that there would be a third party, for example, that he would be starting. Some people are floating the idea of, a Patriot Party of some kind or an America First Party. Well, he made it very clear to us that he was not leaving the Republican Party.
It's more distraction, more chaos.
Yeah, and we made a very strong commitment to him that we would continue the America First agenda because it so well articulates the Republican principles.
So look, I'll admit, I'd actually never listened to Good Morning Salem on KSLM. And if you haven't either, let me kind of give you a quick example of the type of program it is. About halfway through the interview, the host insinuated that Governor Brown used COVID to shut down businesses so that it would be harder for Republicans to raise campaign dollars.
One of the challenges, I believe, of COVID this year is because all the businesses, the small businesses that would support our Republican candidates were harmed. They didn't have the funds. They didn't have the ability to give or host fundraisers because of all the COVID restrictions. It's starting to look like this might have been planned, right? You look back and you're like, how interesting is all of this? But
could be, yes.
Except, no, it wasn't at all. And there's like a lot of evidence and fact to prove that, considering 2020 was a record year for fundraising across the board, across the country. The GOP in Oregon saw donations go up fourfold. They raised more than $1 million, something that Courier explained actually a little later in the interview, but never corrected that misinformation. Something that elected Republican lawmakers have now felt compelled to do. GOP members of Oregon's House, they sent a joint statement to us that said there is no credible evidence to support false flag claims. We also reached out to the 9 Republicans in the Senate. Now, 3 of them told us that they agree with that statement from the House. 4 have not responded yet. We're waiting to hear back. And we got these responses from the last 2. Senator Dick Anderson from Coos Bay said, "I will leave the party politics to pundits and party officials for now." And Senator Dallas Hurd of Roseburg responded with, "Unfortunately, Senator Hurd is not available for comment at this time. But it is safe to say for the Republican Party, the time is now." I spoke to political analyst and Republican Rebecca Tweed, who described a minority party in this state that's going through a real identity crisis.
A resolution of this nature with the aggressive language and the frankly completely false and discredited types of claims makes other Republicans feel like they need to distance themselves. Not only is it not the right direction or areas that the Republicans should be focused on in the state, but a majority of Republicans don't agree with this type of message. And I think we're seeing that very clearly in our elected leaders, certainly folks that I've spoken with in the last week, looking at this, feeling like we need to come out and say this doesn't represent our values and we disagree with this. And, I don't know what the strategy behind the resolution was. I can't think of a logical one. When I first heard about this, I thought it was fake news. I just couldn't believe that this was the type of thing that would come out from the party I'm a member of. But it does appeal to a certain electorate. And there's extremes on all sides of the parties, on all parties. But this certainly was not appealing to what I consider a majority of the Republicans I work with in the state.
And I'll say it again, to Bill Courier or any other ranking Republican who wants to talk on this show, the door is open. You don't even have to use the hashtag #HeyDan. I prefer that you did, but you don't have to. Obviously, things are pretty heated in the world of Oregon politics, right? Let's check in, though, with our neighbors in Washington, because I hear there's a pretty big political debate going on there as well over the state dinosaur. Yeah, this is something they're dealing with. Okay, the debate isn't actually over which dinosaur they'd pick. That's kind of been settled. The issue is that there's a bill in the legislature to make the Sushisaurus Rex Washington's official dino. A class of 4th graders, they came up with this idea. I like it. Great idea. But some people aren't happy that lawmakers are spending their time on this right now with, a pandemic and economic collapse to deal with.
It's nothing to do with the dinosaurs. It's nothing to do with about providing an opportunity for kids to be engaged and take advantage of remote testimony. It is a question of timing and priorities.
So there was a hearing on this bill this week. And to be fair, it only lasted 20 minutes. But it does still take some time and some effort when bills like this go through the process. I mean, someone has to write it. They have to assign a legislative staff member to work on it. They have to make sure that it's scheduled, things like that. So there is work to be done. But but a lot of frivolous bills, you have to keep in mind, get written each and every year, including here in Oregon. We've got a lot of crises going on here as well, obviously. But there is a House resolution in this session to make shelter dogs and cats the official state pet. Is that important? No, not really. Not compared to all the other things, but is it really going to stop us from getting the important things done? Probably not. That's what walkouts are for. Speaking of frivolous things, let's check in on what's going on in Portland City Council. Proclamation to make today Health for Humanity Yogathon Day. Okay, that's fine. It's 2021. We need to, it's okay. We're going to talk about something next that's a little bit more serious. Using coffee filters in your face masks. That's a thing now. We're going to finish the story right after this. Welcome back. So I don't want to get into this whole big mask debate again because frankly, it's not really a debate. Everyone should be wearing a mask. I think we should get that pretty much understood at this point. But some people want to know if they should take it a step farther, like Anne, who wrote in and said, I heard that some people are putting a paper coffee filter inside their single mask instead. Is this a good alternative? So we thought this would be a good question for Keely Chalmers to look into.
What I did was I took a coffee filter.
Search YouTube, you'll find them. All sorts of creative and pretty impressive videos on how to make a face mask out of a coffee filter.
And what you just created is the top and the bottom.
Makes sense. I mean, it is a filter, but just how effective is it in filtering out those tiny coronavirus particles? It was a question researchers at Virginia Tech University wanted to answer. They conducted a study looking at the effectiveness of 1, 2, and 3 layers of coffee filters. Dr. Richard Corsi, an air quality expert at Portland State University, followed the research.
And they showed that coffee filters can have some benefit.
Now, keep in mind, this was a single study done back in April of last year. It concluded that the effectiveness depended on how many layers were used. 1 or 2 coffee filters didn't show much benefit. However,
if you put 3 coffee filters layered on top of each other, you can get on the order of 50 to 60 or even 70% removal efficiency for particles of the size that we care about for the coronavirus.
But Corsi points out, while 3 layers does better at filtering out the virus, they also make it tougher to breathe, and air will always find the path of least resistance.
It's harder for air to get through the filters, and air will find those creases around your nose and openings and leakage points around the mask. And you'll get more air just coming right in through those leakage points and not going through the mask.
He says one trick to sealing up any openings in your mask, good old-fashioned tape.
Tape up the creases, and it stays sealed for a pretty long period of time if you do it right.
Right now, there's a lot of research being done on best mask practices. The findings show that increasing the layers to 2 to 3 is a lot better than just 1.
The more layers you have, in theory, the more particles, that virus-laden particles, you'll be able to collect.
As for the best materials, that research is ongoing, but studies have shown promising results from other household items like certain pillowcases. The bottom line, if you do want to make your own mask, simply doubling up won't cut it.
So you have to make sure that you have a good fit and that the mask is breathable at the same time as you want these multiple layers. It's a bit of an art in the science.
In Portland, Keely Chalmers, KGW News.
I can't wait for masks to be gone forever. Oh, am I alone in that? No. Pat Matson wrote in and said, yo, Dan, it's hey, Dan, but yo, Dan, coffee filters and masks? Yeah, I'm more of a Keurig guy. I'm with you on that. I go with the pods. Bill wrote in and asked, will people who have had COVID and recovered from it be required to get vaccines? So at this point, yeah, the CDC is still wanting those people to get vaccinated because they're not really sure how long you will be immune from COVID after you actually get COVID. So they say you still should get the shot just to be sure. I know there's a little bit of a time frame in between when you are kind of not testing positive for it anymore and when you should get the shot, but that's something you should talk to your doctor about. We're still getting a ton of questions for Governor Kate Brown. Our Pat Doris is sitting down with her tomorrow. I know you have a million out of her, but let us know what you want to know and we'll see if we can get those questions answered. That's the story for tonight. I'm Dan Haggerty. We'll see you back here tomorrow.